So today we are doing another Healthcare Channel video, and I would like for you to go ahead and introduce yourself. Our topic today is Parkinson's disease, but if you would go ahead and introduce yourself.
Okay, I am Dr. Thomas. My first name is Madhavi. I am a movement disorder physician. I've been in this metroplex for about 15 years now,
Okay.
and I specialize in Parkinson's and movement disorders.
Okay. So tell me, we've all heard about Parkinson's, but I don't think we know the details of it. So if you can kind of tell me what it is first, let's start with that.
Okay, Parkinson's is a movement disorder, so usually in that condition you have lack of movement, so a person can slow down. So if you watch older people, sometimes they are slower when they walk, but this is not just aging. This is a disease which is a neurodegenerative condition, so there are brain cells that are dying over a period of time, and patients start to shuffle, they lose their balance, or they have tremor, they have slowness of motion, including their face.
Okay.
And if it's not treated, it can be very progressive and cause bedridden state in a period of 10-15 years.
Okay.
It's a slow-moving disease.
Okay. And what causes Parkinson's?
We do not know the cause.
Okay.
There's about 2 to 4% of cases that are genetic, meaning they run in the family.
Only 2 to 4?
Yes.
Wow,
And
okay.
in the majority, we do not know the cause.
Okay.
So we believe there is a genetic predisposition to having Parkinson's, just like someone could have cancer.
Right.
But not all genes are identified. And there's a link to environmental toxins as well.
Okay.
And recently there's been more awareness about pesticides and how they can cause Parkinson's potentially.
Okay. How do you, obviously if you've got some symptoms, but is there a certain age that it begins to show up? And then how do you test for it?
So majority of patients are between 50 to 70 years of age. That's the biggest group.
Okay.
And then there's also patients who start after 80.
Okay.
And it's also juvenile Parkinson's, which starts under the age of 20. My youngest patient was 11 years old when she started.
Oh my goodness.
Yeah.
So what's the treatment?
We have various medications we can give a patient to maintain their quality of life.
Mm-hmm.
And we also do brain stimulation surgery. There is no cure to this condition, but mostly we focus on maintaining the patient's quality of life.
What's the average span that someone can live with Parkinson?
Normal average lifespan.
Oh, really?
If well treated.
Okay.
If someone is not paying attention to their health and delay treatment or delay exercise programs, those patients don't do well.
Okay.
So just like any other condition, if someone has a sedentary lifestyle, they're not going to do well. Versus a patient who takes action, and works on their body and mind at the same time.
Okay. Are there other diseases that are normally associated with Parkinson's, or?
Not typically.
Okay.
There could be other conditions that look like Parkinson's. So in England, we had a brain bank study, because it's national healthcare. So they could track the patients throughout their life, and then when they passed away, they studied the brains of many of these patients, and they found out that there were some other conditions that looked like Parkinson's when the patient was alive, but they were actually not Parkinson's.
Huh.
So for example, we have a lot of Parkinson plus conditions. So people can have vascular Parkinson's. Someone keeps having multiple strokes. They cannot walk right. They can have lower body Parkinson's. And also some dementias, they look like Parkinson's. There's a variety of Alzheimer's that looks like Parkinson's. And there's another condition called dementia with Lewy body, where they have memory problems and dementia. and progressive supranuclear palsy. There's a few untreatable conditions that are worse than Parkinson's and more aggressive.
Mm-hmm.
So when a patient comes to the clinic, we first take an interview, just like you are talking to me,
Right.
and then we discuss their whole life pretty much. I need to know everything about them and when their symptoms have started. And something as simple as losing sense of smell could be a first sign. Or someone not sleeping well. If you hear sleep centers everywhere,
Yes, it's
some
a
of the
common thing.
It's a common
Yeah.
problem. So some people don't sleep because they can't stop thinking about their life.
Right.
But there are a lot of people who have dream states.
Mm-hmm.
It's called REM behavior disorder. So we all go into that REM sleep where we dream. These patients, instead of their body being still, the body is very active and actually act out their dreams. So they pick that up in the sleep center. So two early signs of sleep disorders and smell, losing sense of smell and taste.
Okay. And so if anybody's experiencing that, they need to call
They
you.
need to think about it and say, am I having any other symptoms? You
Right.
know? And nowadays we have a test called PET DAT scan or dopamine scan.
Uh-huh.
In the past, we used to have PET scans, which were limited to research centers only.
Mm-hmm.
Now we have these scanners that scan the dopamine in the brain. So you can actually go into, much like a stress test,
Mm-hmm.
it's a nuclear medicine test. You go to the lab and they will give you an injection. You have to sit and wait for like a few hours, almost 4 to 5 hours, for that tracer to get to the brain, and then they take pictures. It's like a CAT scan. And we can actually look at the brains and we can tell that they have less dopamine. So
that's a sign?
That's a test for
Okay.
Parkinson's.
Okay.
It's been around for at least 10 years now, but not many people are aware of all this.
Yeah.
Because it's not a common condition.
Yeah. I was going to ask you, how many people on the average normally, what percentage of the population?
So they say it's about 1 in a million.
Oh,
roughly.
wow.
It's not a common condition.
Okay.
But if you go to certain areas of the country, it's more.
Really?
Like Midwest, and even in our state,
Mm-hmm.
it's more common in East Texas.
Why?
Agricultural communities, you know, so like more exposure to pesticides.
To the pesticides. Interesting.
Yeah.
So anything else that you would want to make sure that we all are aware of in regards to Parkinson's?
Yeah, so locally,
Okay.
we are starting a Parkinson Center at Medical City, Arlington.
Yes.
So the services will be available to our area now.
That's great. Okay.
And then we're going to slowly build it into a rehab program as well. Plus, we are recruiting a new surgeon.
So that you can treat it?
Surgeries, yeah.
Okay.
So more awareness in the community, and if patients take action, we can have a good, healthy, long life.
Okay.
Yeah.
Well, thank you very much. I appreciate you taking the time to visit with us.
Thank you.